Thank you for taking a few minutes to learn about AAPA's 6 key elements of a modern PA Practice Act. States have modified their approach to PA regulation in response to a growing body of information demonstrating the safety and high quality of PA practice. AAPA has identified 6 specific components that all state PA Practice Acts should contain. Together, these elements create an ideal regulatory environment for the profession that allows PAs to practice fully and efficiently while protecting public health and safety. Licensure as the regulatory term. Compared to the terms certified or registered, licensure is the preferred regulatory term as applied to PAs because it denotes the highest level of scrutiny of professional qualifications. In addition, this term ensures PAs are included in state laws that refer broadly to licensed health professionals. All states in the District of Columbia now have this key element. Full prescriptive authority. Prescribing medications is integral to the practice of medicine. All PAs are required to complete extensive training in pharmacology as a part of their PA education. Laws that restrict PA prescriptive authority have the potential to cause interruptions in the delivery of care and can result in additional costs to the system. State laws should authorize PAs to prescribe all legal medications, including Schedule 2 through 5 controlled medications. Scope of practice determined at the practice level. PA scope of practice that is determined by the PA, collaborating physicians, and their healthcare team allows for flexible and customized team function. As teams decide on clinical roles in a practice, the needs of patients and the education, experience, and preferences of the team members shape these roles. State laws that include a specific list of services that PAs can provide, or laws that require the scope of practice of each individual PA be approved by the state regulatory agency, restrict the ability of healthcare teams to customize practices. Adaptable collaboration requirements. Restrictions that impose a proximity requirement or require a physician to be on site with a PA at specified intervals are cumbersome and inefficient. In situations such as assisting at surgery, the PA and physician will be in very close proximity. But if a PA is providing services in a rural primary care setting, mandating the physician to be constantly or even intermittently on site creates inefficiency and limits the team's ability to expand access to care. A more adaptable approach accounts for the ability to consult using telecommunication, allowing teams to provide better care for more patients. Chart co-signature requirements determined at the practice level. In the early years of the PA profession, co-signing PA chart entries was a way for physicians to demonstrate they were closely overseeing PA practice. But 50 years of collaboration between physicians and PAs has shown that decisions about patient care and chart review are best tailored to the needs of individual practices. Ongoing communication between providers caring for a group of patients enhances coordination of care and patient outcomes. Reviewing medical record entries may be part of this communication, but it should be at the discretion of the providers and not required in law. Number of PAs a physician may collaborate with determined at the practice level. State laws and regulations should not limit the number of PAs with which one physician may collaborate. Nor should they stipulate that a physician can collaborate only with specific named PAs. The number of PAs that a particular physician works with should be determined by several factors that may vary widely across practice settings. In primary care settings, a physician might collaborate with multiple PAs, while in a complex surgical setting, a team of one PA and one surgeon might be appropriate. Any physician-to-PA ratio in statute or rule cannot account for these differences. These 6 key elements are reflected in AAPA's model state legislation for PAs and in AAPA's guidelines for state regulation of PAs. Currently, states have varying numbers of key elements in their laws and rules, but there have been significant achievements in the past several years. AAPA is working closely with state PA chapters to incorporate these elements into all states' statutes and regulations. For additional information about PA state laws and rules, visit the AAPA website.